Hi, continuing the series on prevention of preterm deliveries. Now I would also deal with something called as short cervical length or cervical problem leading on to preterm deliveries. Cervix is a structure which holds the pregnancy till term, and we can serially see certain kind of changes in the cervix which can predict us that there is an increased chance of preterm deliveries. We start this monitoring somewhere around 12 weeks. We look at the length of the cervix, we look at the angle of the cervix, we look at there is any serial shortening or changes in the cervix. There is also something called as elastography. That means we check whether the cervix is firm or very soft. So that these changes can be seen on a special ultrasound program called as elastography of the cervix. So which would predict if this patient has a very softer cervix, which can lead on to a premature delivery. So if we see that the cervix is short or it's getting softened, then there is an option as to whether we can go for a cervical encirclage, or we can also manage with a progesterones or certain other lifestyle changes. Most of the time we can still manage them medically without going for any surgical intervention. Some of the medical management which we can inculcate is, one is make sure that there is no infection in the vagina. Infection causes softening of the cervix, which could again bring about labor and preterm delivery. So we may have to take cervical swabs and look at what kind of infection, and then probably treat that infection. Next is looking at the microbes of the vagina. See, we know that vagina is inoculated with certain good bacteria called as lactobacillus. Because of recurrent infection or because of the pregnancy itself, this microbe environment changes. So in this women, if we can put them on the lactobacillus tablets or certain other precautions which improves the normal bacterial environment of the vagina, which can again prevent preterm delivery. And then of course progesterones, there are numerous studies which have shown that it can prevent premature deliveries and also very extreme preterm deliveries also. So in our setup in Aster, what we do is we do a scan around 12 weeks, and then again we start monitoring this patient, because every time you come, it doesn't take a very long time for us to just have a look at the cervix. You can also do an internal examination and feel the cervix, but with an ultrasound, this detection of cervical incompetence or cervical softening can be very easily detected. So at around 16-17 weeks also we again see the cervix, and when you come for anomaly scan, we again see the cervix. So if there is not much of a serial changes at this stage, then we say okay, cervix is quite good enough, and then we don't have to really go ahead. But then if we see some kind of a serial downward trend or shortening of the cervix, we can continue monitoring you and continue the progesterone tablets. So that's the medical way of managing unexplained preterm deliveries.